A very good afternoon to everyone. Thank you for joining us for the 8th webinar of COVID-19 Ask the Experts series, co-organized by DBT THSTI, DBT Welcome Trust India Alliance, IAVI, and Nature India. We usually get to questions later in the webinar, but as I browsed through some questions that the participants sent us for the panelists, one really stuck to my mind. How do I make sure I'm not scared of COVID-19? While I leave it to the experts to respond to that, I would surely like to point out that most of us are scared and worried. Scared to step out of our houses, worried we might lose our jobs if we don't, worried about old parents and children home. Whether we like to talk about it or not, some people are scared to go back home because of domestic abuse. And whether we like to talk about it or not, some people don't have a home to go to. The pandemic has made mental health challenges more visible than ever, which, if not taken care of, will certainly overwhelm our society's well-being in its entirety. Today, we dig deeper and make an effort to ensure you all go back more ready to deal with the unknown. We could not have pulled off this webinar series without an amazing team. So I am very thankful to Yukti, Hina, and Sara from India Alliance, Devalina from IAVI, and Shubhra from Nature India. Before I introduce you to our speakers, there are a few things I want you to make note of. This webinar is being recorded and will be shared widely with everyone. You can submit your questions anytime in the question box, and please keep them short and to the point. Panelists are providing their views on the current situation as experts and are not speaking on behalf of the government or of associated organizations unless stated by them. In case the webinar ends abruptly due to a technical glitch, you can always join back using the registration link sent to you. Coming to our speakers, Dr. Shyam Bhatt is a trustee of the Live, Love, Laugh Foundation, a psychiatrist, integrative medicine specialist, and writer. Dr. Bhatt has a rare combination of postgraduate training and American board certifications in two specialties, psychiatry and internal medicine. After a 10-year stint in the UK and US encompassing medical training and practice, Dr. Bhatt returned to India in 2009. With the vision of practicing a holistic form of psychiatry and medicine that integrate the best of India's ancient therapies of mind and body, along with the latest evidence-based treatments from Western medicine and psychiatry. Then we also have Dr. Lakshmi Ravikant, who is the Deputy Dean at the Banyan Academy of Leadership and Mental Health. She has had a counseling practice in Chennai for more than 2 decades and has been associated with the Banyan right since its inception. She has pioneered online counseling facilitation called Seek Spark that enables video and telecounseling and has been a part of the strategic planning for the Banyan for 28 years. She writes about mental well-being and recently became one of the key editors of the Indian Journal of Psychological Counseling. We also have with us Professor Vikram Patel, who is the Pershing Square Professor of Global Health in the Department of Global Health and Social Medicine at Harvard Medical School. He co-founded the Center for Global Mental Health in 2008 and is a co-founder of Sangat. Professor Patel leads research that plays a central role in the emergence and development of the field of global mental health and has galvanized policy, civil society, and donor action to address the large unmet need for care for people with mental disorders, both in low and middle income countries and in low resource contexts of high income countries. We also have with us Dr. Sumi Jain, who is a public health professional since 2006 and is currently a consultant with the Department of Health, Chhattisgarh. She served as a consultant at the State Health Resource Center, Chhattisgarh from 2008 to 2014. Since then, she has been working with the National Health Mission of the state as Program Coordinator, NCD and Mental Health. She provides technical support for various health programs like the National Program for Prevention and Control of Diabetes, Cancer, Cardiovascular Disorders and Stroke, National Program for Health Care of Elderly, and National Mental Health Program. we are really excited to have you all over here today. We live surrounded by uncertainties. For an individual already living with a mental health condition, it's harder. Dr. Shyam Bhatt from the Live, Love, Love Foundation will talk to us more about uncertainty and why some of us find it hard to cope with it. The foundation has made strides in normalizing conversations about mental illness to reduce the stigma around it over the past few years. Over to you, Dr. Shyam, for more.
Thank you, Shuli, and thank you to India Alliance for organizing this. And it's a pleasure to be here with an illustrious panel of experts. And of course, we're talking about something that is affecting everybody. And I think every psychiatrist, like everyone else, has never seen anything like this before, where a global event has affected everybody. And it's certainly unprecedented in our lifetimes. So, we are all seeing a lot of people suffering from stress, anxiety, depression, relationship issues, worrying about COVID. And as you were saying, it's perfectly natural to some extent. I mean, this morning I woke up with a sore throat, and you that all ages today, young, middle-aged, old, everybody obviously has the stress perception has been increased by this global event. So let me just, in this next few minutes, talk very briefly about what stress is, why this pandemic is causing so much stress and anxiety, and maybe a few words about what we can do to actually, each one of us, what we can do to reduce the stress in our lives. And of course, at the end of this discussion, we'll explore this further when you can ask questions. These stress detecting systems have been there forever. I mean, if you look at our ancestors, the early man roaming around the savannas of Africa, obviously one of the key sort of factors for survival was the ability to detect threat and then to evade threat when you detect threat. And so you, I, all mammalian species have a similar threat detecting system. And this is what we call subcortical, meaning it's not under your conscious control. You cannot will your threat detection systems to be switched on, and it's equally difficult for you to use willpower to switch them off. So the brain is exquisitely sensitive to threat, and the moment it detects threat, and here exemplified by the saber-toothed tiger, the moment the brain detects threat, it sends signals to the rest of the brain and the body in order to start averting and fighting the threat. So you've heard of the fight, flight, or freeze response. And this is basically what it is. The brain detects threat, releases hormones through something called the HPA axis, which starts from the hypothalamus in the brain right up to the adrenal glands sitting on top of your kidneys. And these adrenal glands secrete hormones, stress hormones like adrenaline, and that prepares the body and the brain to fight or run away from the predator. And if neither of those two are possible, then the organism, the human being or any other species, when faced with a threat it cannot evade, will go into a freeze mode. Now, this is all very well when we face acute threat. In fact, this is what keeps us alive. This is what allowed our species and all species to survive threat and danger and to take necessary precautions. But if this reaction continues and continues for days and months on end with no end in sight, and really you can't really fight with the predator or run away from a predator, then this becomes what we call chronic stress. And chronic stress, because it's not really helping you evade the threat, is a continuous, perpetual kind of state where your body is in a state of fight or flight, and that's not very healthy beyond a brief period of time. So as you can see from this slide, when you're in chronic stress, every part of your body can get affected and is affected. So people who suffer from stress, can get all kinds of symptoms from head to toe. Almost any organ system can be affected. So commonly people can feel anxious, irritable, not able to sleep well, not able to focus, might have changes in your memory, focus, concentration. And of course, what is also pertinent and something to keep in mind is that this is not just a mind thing. It's very clearly a physiological reaction, and therefore we know that it affects the immune system. And so the irony is, as we stress about COVID-19 and the pandemic, in actual fact, that stress has the effect of actually weakening the immune system. Now, why do we as human beings feel so much stress, so much threat, so much anguish in a situation like this? Because keep in mind, this is not the same as the tiger. We don't have a threat in the right next to us, in a sense that's not immediate in that sense. It's not absolute in that sense, and yet because of our brain systems, the way they're constructed, it feels like life or death. And so when you take the same ancient neural systems and you put them in today's environment, even before COVID-19, there was a lot of stress. And today with COVID-19, some of the key reasons people are feeling stress, number one, is uncertainty. Not knowing what will happen exactly, not being able to quantify the risk, not knowing the probabilities, still so much is uncertain and unknown about the condition. That uncertainty causes a lot of stress for the human brain, because our brain is designed to try to predict the future. So constantly our brain is making predictions about the future, and as long as we have a reasonable ability, as long as we're able to predict the future reasonably, our brain feels relatively relaxed. But when our brain is faced with a situation where, as it looks out into the future, it doesn't get enough information, that sends the brain into confusion and stress. And there are actually many good research studies looking at the impact of uncertainty on stress. And in one very interesting study, they found through a video game where they could modify the amount of uncertainty. And the video game essentially was, players would have to overturn rocks and see if there was a snake underneath that or not. If there was a snake underneath that, they get an electric shock. And if there's no snake, they don't get a shock. And throughout this whole experiment, their stress responses is being monitored physiologically. Now, what they found was that most people feel more stress when they're not sure whether or not they're going to get a shock, even compared to knowing for sure that they're going to get a shock. It was more stressful for participants to be in a situation of 50% possibility of getting a shock versus 100% probability, and knowing that to be true, that was less stressful. So we are so hardwired to avoiding uncertainty that we prefer almost certain discomfort to the uncertainty of whether or not something bad is going to happen in the future. So keep in mind that the brain is a extrapolating, narrative generating, predictive machine, and if it doesn't have enough information, then you have all of these symptoms. It's one of the many reasons, of course, but I'm focusing on that in this talk. Creates a lot of anxiety, sending all those threat signals in the body, and that actually worsens things because threat makes people hypervigilant. Hypervigilance means now the brain is in a state of looking for more threat and more danger. So instead of seeing the positives now, because our brain is in a threatened state, we are starting to see more and more negative things. And of course, a lot of people during this time will try to cope with stress using the strategies that have always worked for them, perhaps in times of lesser stress. And a lot of these strategies are not helpful. In fact, they're harmful. Smoking or drinking too much, overeating, undereating, that's become a big thing, by the way, in the COVID pandemic. A lot of people are turning to food. Of course, substances are a big issue. And if you don't take care of this, of stress in a healthy way, then there's a risk of clinical anxiety and depression. And by the way, from past epidemics, we know that significant numbers of people after traumatic events had post-traumatic stress symptoms, substance abuse, depression, anxiety long after the event. So for example, after 9/11, 3 years, or rather 5 to 6 years after exposure to the 9/11 attacks, those who were drinking more to cope with that stress were continuing to drink excessively 5 or 6 years after the event. So it's fairly long lasting. Now,
Dr.
in
Sham,
interest of
sorry,
yeah,
I am intervening you. There's 1 minute to go for your presentation.
sure, thank you. So that's the overview. And in the interest of time, I want to just, leave you with a couple of things. Now, we know that this is happening. We know people are stressed. But what I want to underline is that there's a lot of literature about something called post-traumatic growth and a related idea, the idea of resilience. And what we know is that when times are difficult and when people go through suffering, they can use that time as a significant opportunity to learn something about themselves and about life, to transform anguish into a deep appreciation of life, into having renewed possibilities in life, into having better relationships with others, and actually radically transforming themselves so that they emerge from the experience much stronger, more optimistic, more compassionate, and more loving and kind. And we know that that is possible. It depends on how we frame this experience. So I'm going to stop there, and thank you for for your attention, and I'll be happy to take questions and at the end of this presentation.
Thank you, Dr. Sham. I totally agree with you. Being able to understand the underlying basis of what affects our mental health will surely help destigmatize the conversations around it. So the needs for those who live on the margins are our collective responsibility, goes the mission statement of Banyan, an NGO that has reached out to more than 100,000 people across 3 states, most of them homeless. To know more about how they accomplished this feat and understand engagement with communities to address mental health challenges, we have with us Dr. Lakshmi, who will tell us about how Banyan came about to have an immense impact on the lives of these people through creative, clinical, and social methods and innovations. Over to you, Dr. Lakshmi. Lakshmi, can you unmute yourself? We are not able to hear you.
Yeah, can you hear me now?
Yes, we can hear you.
Hi, sorry for that delay.
No.
Not very good with technology, but nevertheless repeating myself and saying good afternoon, Shirley and India Alliance. Very good afternoon to my very esteemed co-panelists. I really thank you all for giving Banyan particularly this opportunity and BAM to make this very brief presentation. On record, I'd like to also thank Vandana, my team, Renalini and Purani, to have helped me to set up this presentation, which I'm really hoping to make very brief. So while the title does say mental health challenges in facing the unknown, and it is a presentation from an organizational perspective, not a very generic perspective, I think in no 2 words do I mean that our motto, I exist, therefore I am, could be more pertinent than in today's times. I'd like to move to the next slide. So what I'm going to be sharing really is a very, very quick overview of our services, not only till date, but also what we are doing, just to put the whole conversation into some context. So yeah, we do have, if you look at your slides, we do have hospital-based services. Before actually I go into that, maybe I must reiterate that we work with homeless, mentally ill women, men, and perhaps their children as well now, and across the length and breadth of the country, but more particularly in the states of Maharashtra, Kerala, and Tamil Nadu. These are the most vulnerable women who have been rescued off the streets, men also to an extent where we work with the government shelters in Chennai. And so that's really where we began, and that continues to be the kind of work that we will continue to do. So therefore, to come back to the context that we have emergency care, ECRC, emergency care and recovery centers, service centers, where 500 homeless persons in 2 districts of Tamil Nadu and 1 district in Kerala are being serviced. You've already mentioned the populations that we've reached out, Shuli. We also work with a homeless shelter, which is the NALAM, or National Urban Livelihoods Mission, where we focus on psychiatric and psychosocial care-based services for more than 150 people per year. We have serviced more than 1 lakh people from low-income households, tribal communities, both in Aghai and in Tamil Nadu, the Irular community, popularly known for their snake and rat catching activities. We do support more than 800 children with parental mental illness in various ways, through tuition centers, through psychosocial support, to also be able to ever be observant and watchful for early warning signals, and so on and so forth. Making it really brief, we do focus on livelihoods because we know now, over 28 years of existence, that mental health care would be very deficient if we do not provide social care facilities and benefits in the best possible manner. So we focus on livelihoods and, as much as possible, access to social care entitlements. We've reached out to 8,000 beneficiaries, some of them being, maybe getting an Aadhaar card, maybe talking about a disability allowance, maybe talking about direct bank transfers, employment, education, reskilling, and so on and so forth, housing, etc. We also look at long-term care options for persons with severe mental illnesses, with very severe disability, multiple disabilities, if I can say so. And these options can range not just from IP, that inpatient care, but also to transit them gradually, and when they are ready, to more independent living, to supported housing services, where more than 4,000 of our residents or clients have been reached. Yeah. Now have the next slide, please. So that's a quick overview, but then I think it's very important to place here in the context that we are in, that our entire principle of our guiding all our processes, whether they are psychiatric processes, counseling processes, social facilitation processes, our guiding principle and ethos has always been to build an inclusive and a humane world that promotes capacities, capabilities, justice, and equity. I'm not talking about this from a very theoretical sense, while we do rely a lot on Nussbaum, and as well as, I think none other than Amartya Sen's the capabilities approach, where our entire framework of engagement has to be deep with the people that we work with, has to be responsive to the needs of the people. I would say, more than empathy, start getting attuned to the needs of the homeless, mentally ill, most vulnerable populations of this country, the migratory populations today. See that from the perspective of rights, from a rights-based, choice-based work, promotion of whatever capabilities. I mean, we do talk about loss, but we, at the same time, I think on the other side of the coin of loss is gain and capabilities. We do focus on a very, very large, multiply creative ways of recovery, which is not just medical recovery, as we all know, not pathological, answers to very deep-rooted mentally ill problems, but maybe focus on personal recovery in terms of recovery from trauma, recovery from the the debilitating aspects of a relationship. So I'm not really going into details. Recovery from being who they were to who they are now. So I'm really expanding all of this, and then of course seamlessly across all the work we do and we intend doing is in the framework or with the lens of equity and justice to the best possible extent. So we do focus on the quality of life of every individual and see what are the social care needs they would require, because we know that these are intrinsically linked today. Your QOL and the quality of life you need. We all know that. Imagine the person who doesn't have water, doesn't have a toilet, whether it is doesn't have access to food, what is that quality of life, and what kind of social care facilitation, and how it then loops back into the pre-existing mental health conditions, or maybe predicting other kinds of mental health issues. So therefore, we try to broaden the entire scope of mental health responses, especially in the context of the very, very disadvantaged and marginalized. We are trying to see, looking at reversing the social drift among the most vulnerable populations and tackling social causation. So while we are a mental health service organization, at no point in time can we ignore the realities of today's society and what's happening. So that is the real founding and the guiding principle on which all of our services are rendered, because it is important. No other time have we thought that equity, social justice, and responding to the needs of the most marginalized and of course people who are affected with COVID, with mental health issues in particular, need to be seen from that lens. So in the COVID context, coming very quickly, what is it that we've done? We have 3 columns here. One is, of course, we have to talk about our inpatient care. We have a very strong task force that's been set up. We have extremely strong safety protocols in place. I've shared a huge resource, document with the group, and that can be circulated so that we don't go into the nitty-gritty within the given time. We have followed very strong guidelines on nomenclature, whether it's social distancing, but distancing, nevertheless, physical and otherwise. Public health measures have been on paramount for us because, today we are not looking at, health as not just mental health, but a very, very imperative public health measure for both inpatient, outpatients, aftercare clients, their families, etc. So we do have measures in place, such as, monitoring of vitals, the temperature, SpO2 levels, management of health concerns locally, escalation and testing protocols. All of this is there in the resource book. Supplies procured in advance so that we are planned and we don't feel frantic when things are closed and we don't have access. And of course, we also look at staffing ratios that have altered. We have made it 1:20, 1:30, with a lot of task shifting and task sharing. Now, our rapid response to COVID has been that we did a recently between April 23rd, after the March 23rd to April 15th, when we had the second and coming to the third lockdown phase, we did a very strong need assessment with our clients, 1,800 plus clients who have the ability to speak to you on a telephone. Because I don't need to go into why we could not reach out to people and more in person. So 50% of our clients are accessing outpatient mental health care and aftercare services. We learned and we know live on less than 5,000 rupees, and family income, and this could get drastically low, and it's a very, very scary situation. Many of them who are, have now lost their existing jobs and their means of livelihood, which is again going to become a precursor to maybe more mental health issues, not only for them, burden on the families, and also for their children's future in terms of education and so on and so forth. So our outreach services, if I can go here, psychological reviews, of course, how social distancing, partial clinics, being available as psychiatrists and social workers and psychologists, door delivery of medications where possible for over 200 persons, dry rations delivered to more than 400 clients for across 2 to 3 months, responses of direct bank transfer more than the poorest of the poor, 450 clients for about 2 or 3 months as per need, and then looking at multiple ways of livelihood support, establishing small cooperatives, small soup kitchens, maybe community kitchens, little grants for their own businesses, tailoring, and so on and so forth, for more than 60 clients. And of course, in the forefront, since we work with the tribal mental health services in Maharashtra, Aghai, and the Irregular community, to also have, knowing that they go through different kinds of structural political violence, and then they don't need, more to their mental health distress. So to be able to provide some of special care services for some of these tribal communities. May we go to the next slide? Thank you so much for helping me with this. Yeah, so our takeaways are important not to medicalize all problems and classify them as disorders, social responses needed in mental health service interventions, and our next steps for COVID response is the toll-free helpline, referral, and the resource hub. The clinical services are going to be psychological and psychiatric and social needs facilitation in terms of entitlement, access, and livelihoods. I think with that, I'm done, if I'm not mistaken. Thank you very much for giving Banyan and Ban the opportunity. I do hope this presentation has been useful. Thank you very much.
Mental health care will indeed be deficient if we also don't look into social care. Thank you, Dr. Lakshmi.
Thank you very much.
The specific references to mental health and substance use as targets within the Health Sustainable Development Goals reflect a transformation in the global public health policy. I'll invite Professor Vikram Patel now to tell you more about what this means for people living with depression. Professor Patel, you will need to unmute yourself. We are not able to hear you.
Hi, can you hear me?
Yes, we can hear you now.
Okay, wonderful. Thank you so much. And first of all, also thank you to the India Alliance for inviting me. My remarks are going to follow very nicely from what Sham and Lakshmi said. I'm actually going to speak more particularly to a general audience on the subject of depression in particular. But I wanted to start by taking off from where Lakshmi ended. I think what we heard from Sham was the acute response to the pandemic in terms of our mental health. And I completely agree with him that uncertainty is one of the most important drivers of anxiety, of fearfulness, and all of this, of course, is a result of the effect of stress on the human mind. This is important not to medicalize, as Lakshmi rightly pointed out, and to see this as a normative response of the human mind, which is very deeply rooted in our evolutionary history to extraordinary circumstances that we have never really experienced in our lifetime. However, what I really want to turn to is what is going to lie ahead. And Lakshmi's already alluded to this, but I want to start by, just commenting on a book that was published a couple of months ago by the Nobel Prize winning economist Angus Deaton and his colleague Anne Case from Princeton University. And the book is called The Deaths of Despair. The book is a documentation of the causes of increased mortality that actually reduced life expectancy in one of the wealthiest countries in the world, that is in America, particularly in working age Americans following the 2008 economic recession. Now, this particular analysis documents very clearly that it wasn't just hunger, because in fact there was no hunger really in the economic recession in the US, but a loss of hope. A loss of hope because the world had changed so dramatically, particularly for the Rust Belt parts of the country, and the complete loss of employment and a sense of purpose and future in one society that was driving this mortality mainly through suicide and substance use. And the key mental health condition, of course, that is relevant here is depression. Now, how does this apply to India? We always think India is very different. It's a different place. We have a lot of exceptionalism about our country, but actually there's a great deal of similarity with the US. For a start, we have the same levels, in fact, even worse, of profound inequalities that are likely to increase in the post-COVID era. We have a profoundly weak social security net, and we can see that being played out every single day in the last 3 months with tragic images of the way we have allowed millions of our own people to suffer in such indignity. We are a deeply polarized society, more now than ever before. And of course, our healthcare system is completely fragmented. And so if you think of all of this, plus the enormous levels of absolute poverty and hunger, then I believe that this is a real toxic recipe for a similar surge of despair in our country, and accompanying that, a massive increase in premature mortality. Now, I wanted to turn to some work that I've been doing in the last couple of years and really take this opportunity to share some of the early findings of that work with your audience. I've been leading, along with Professor Helen Herman, who's the president of the World Psychiatric Association, a major new Lancet commission, specifically focusing on depression, which is slated to be published early next year. But what I want to do today is to share some of the key messages that we were just drafting. In fact, last week, this set of messages is particularly directed to the general community and in particular for people with depression and their caregivers. These are messages that are based on the synthesis of a very large body of science spanning a whole range of disciplines from neuroscience all the way through the kind of work that I do, which is much more in the public health area, to generate an understanding of the nature of depression, its impact on people and communities, how it could be prevented, and most importantly, the pathways to recovery. So one of the most central questions that is dominating our public understanding of depression, and this applies across all sectors, is whether it really is a health condition. Because there is really no clear delineation from depression and the miseries of everyday life and the expected range of human responses to stress and loss that we heard about earlier. However, the science shows compellingly that even though these boundaries between the kind of normal human emotional states and responses to grief and loss with depression are not very clearly delineated, this is also true of diabetes. There is really no clear line between, for example, high blood sugar and blood sugar that is considered to be in the diabetic range. In fact, we do know that the experience of depression is qualitatively different from everyday sadness, for example, in terms of its duration, its pervasiveness, how many different aspects of our lives it affects, and its impact on our functioning. We also know that depression can take very many different forms, and it's important to acknowledge that there isn't just the one depression. In fact, there are very diverse forms of depression with different clinical or experiential presentations. Another one of the very common critiques is that depression is a modern invention of psychiatry. And of course, some of the most strident critics say that in fact it's a production of a medical industrial complex, in particular the pharmaceutical industry. Similarly, I've often heard that depression is a Western phenomenon, or that it's a problem particularly of affluent westernized Indians. In fact, the Commission has brought together evidence, this time mainly from history and cross-cultural research, which clearly demonstrates that the condition has been described since very ancient times, including in our own ancient Indian scriptures and across diverse civilizations, well before medicine or psychiatry even came into existence. And that, very importantly, the core illness experience of depression is extremely similar across cultures. Above all, depression is never a person's fault. So, for example, in the current circumstances, if people develop depression, it is not because they're weak. The evidence shows that depression can affect people across the life course, but it is especially an important condition when we are young. And of course, young people's lives have been most extremely disrupted by COVID-19. Their education, their employment, their interpersonal social relationships have all been completely upended. And of course, the real irony is that young people are the least affected in terms of the medical consequences of COVID-19. We also know that, unfortunately, for some people, depression isn't only a single episode, but often becomes a chronic and recurrent story. So if depression is indeed a health condition, if we leave aside now that controversy that has really been the elephant in the room in terms of people's understanding of depression, if we leave aside the fact that that is no longer a controversy, there is compelling historical, cross-cultural, and a variety of other kinds of evidence that demonstrate that it is a health condition, then the next message that follows logically is what you should do about it. Well, the science clearly shows that you should seek help for it, and you should do this as early as possible, because the longer you suffer from depression, the longer, of course, you suffer needlessly, but also the chances of recovery are somewhat diminished. That said, I want to stress that the science shows us that care and treatment is not synonymous with consulting a mental health professional or taking a pill. Doctors, drugs, and diagnoses have really dominated the public understanding of what healthcare for depression should look like. But it is very important for us to remember that not only is that unnecessary for all kinds of depressions, but in fact, our healthcare system is deeply under-resourced to actually even scale up this kind of approach across the country. Just a couple of years ago, the National Mental Health Survey of India reported that about 5% of all adult Indians met diagnostic criteria for depression, and nearly 90% of these people had received no care at all. Importantly, the Commission has shown that there are a wide range of interventions that can promote recovery, with the vast majority of people with depression responding to guided self-help, typically supported by a non-specialist coach, and psychological therapies, typically delivered by appropriately trained community health workers, and antidepressant medication, typically provided by appropriately trained primary care doctors. Now, the organization that I've been associated with in India, Sangat, which has been around for 25 years, is pretty much one of the leading innovators, not only in designing these sorts of community-based interventions, and there is a whole science around how you take psychological treatments that have historically been very complex packages and simplify them while retaining their effectiveness so that they can be delivered by community health workers, and then running large randomized controlled trials. And thanks to this kind of evidence, which of course comes from many other research groups around the world, we can now convincingly say that this is an effective and a scalable approach to improving access to depression care. Ultimately, I also want to acknowledge that a relatively small fraction of people will need mental health specialist care, including rarely brief periods in hospital and treatments such as combined therapies and ECT, but it is a small fraction. How small? Well, the best estimate would be maybe only 1 in 10 people with depression will ultimately need that kind of care, but everyone needs some care. However, the other big limitation in our current state of knowledge is that we don't quite know, we can't predict whether your particular depression will respond to this particular approach or that particular approach. And so what we are really recommending is that everyone should receive a low intensity psychological support intervention, either through guided self-help or a community health worker, but only people who don't respond or have very severe presentations need to see a specialist. It's often, to be honest, and I'm sure someone like my colleagues who are actually involved in day-to-day care will testify, it's often a matter of trial and error to find the best approach. I want to end by really thinking about your role. Your role as a person with depression in the recovery process is central, not only because you're going to seek help early, but also in actively participating in decision-making with your provider, ensuring that your priorities and needs are being addressed. Person-centered care is the hallmark of good depression care. This may, of course, range not only from addressing distressing symptoms like not being able to sleep at night, but also your social concerns like domestic disputes and other health conditions such as diabetes. Addressing your concern in this holistic manner is the hallmark of good care. And if you are prescribed a medication or psychotherapy, always remember to engage with the treatment as you're advised, because only then does it work. It only works if you take it in the right dose, in the right way, and for the right duration. And upon recovery, remember that it is often the case that you have to continue to practice the skills you've learned in your everyday life. Because sadly, as I mentioned earlier, for some people, depression isn't a single episode experience and it can occur again. Finally, when you recover, think about how your journey might help others who are also living with depression, the overwhelming majority of who do so in silence, unable to get the appropriate support and care, either because the healthcare system is unable to provide skilled providers or because the people are too embarrassed to do so for some of the reasons I mentioned earlier. Your lived experience makes you an expert in understanding this condition and the pathways to recovery. And you could play a really important role in sharing this expertise in your community, becoming involved with civil society groups, for example, as a peer support worker or as an advocate, and mobilizing your community to demand that policymakers invest in depression prevention and care, in particular, the scientifically proven interventions, because let me assure you, there's a lot of stuff happening in our country right now that has no scientific evidence base backing it at all. Your voice is crucial to affect policy change if we are to ensure that everyone in our community is able to access the care that science has shown works. Thank you.
Thank you, Professor Patel. Quite a few takeaways there for the many young researchers and professionals who are listening to us right now. Next, I invite Dr. Sumi Jain, who is going to walk us through the impact that COVID-19 had in Chhattisgarh and how the government engaged with medical officers and counselors to cater to mental health needs in quarantine centers of frontline health workers, doctors, and others. Dr. Sumi, over to you. Dr. Sumi?
Hello, am I audible?
Hello? Yes,
Yeah?
you're audible. Yes.
Am I audible? Yeah.
Yes, you're audible.
I'd like
Dr.
to thank the organizers for choosing me to speak on this topic. I've been working with the government for a little longer time, approximately 14 years of experience of working with government, and I'd like to thank even the faculty, co-faculty who are with me. So I'd like to present on the role of government, and I think government has to do much more than what we are thinking and doing. So next slide, please. Next slide. So everybody knows that we are facing a pandemic, which is very new to everybody, and we have so many changes in our life, like social isolation, schools are closed, offices are closed. So people are too isolated in this situation, and you know the trajectory of India, wherein the cases of COVID-19 are increasing, and now we are close to 240,000 cases, wherein we have moved ahead of Italy also, I suppose. So Chhattisgarh also is no different. Our cases are more than 1,000. 3 deaths we have seen in Chhattisgarh till now, and the trajectory of Chhattisgarh is also moving ahead, and it's roaring up. The cases are increasing. Next. Next slide, please. So if you see the Center of Mental Health, which says that the COVID trajectory and the mental health influence, what it will have on people's psyche, if you can see, the need will increase as the pandemic single wave is there. And if there are multiple waves, the need will increase further. And I think the government system should be prepared to handle such increase in mental health need. And even the private NGOs and other people also should be supporting this, so that we can work for the cause of such a big mental health need which is coming up. Next. So if you see in Chhattisgarh, what happened is initially, as we could see, first of all, I'd like to tell about my state. Chhattisgarh is a state in central India, wherein 60% of the population is core tribal. We are influenced by Naxal problems as well. And if you see the mental health survey, it states that 11.5% of people would be suffering from mental health disorders in Chhattisgarh. Approximately, if you see the population of Chhattisgarh is 2.5 crores. So we assume that 25 lakh cases of mental health disorder would be there in Chhattisgarh. And as this COVID pandemic started, the numbers and cases were increasing. And initially, we could found that the cases of stress, anxiety, obsessive compulsive disorders like washing the hands constantly, frequently, worsening of substance abuse because there was a shutting of the alcohol vending and tobacco vending shops, and suicidal tendencies increased. And when you see the response of people, they could they could rarely come out in the lockdown. So they use the helpline and teleconsultation support which the government had provided. Next. Next slide, please. Hello, next slide. Yeah. So when we saw the sudden response, what was the change? We could see that there was a sudden increase in mental health issues, and that too mainly due to social insecurities like loss of job, financial insecurities, and non-availability of basic amenities. And there were increase in the number of chronic patients in the mental health facilities also. But there was a change wherein lockdown people didn't want to reach the facilities for follow-up cases, mainly got affected because of the lockdown. Medicine availability for the chronic patients were very difficult, and in far-flung places, still we are not able to provide medicine to the people. By reaching to their home. If you see the big impact was an OPD and IPD. There was reduction in the number of patients, and emergency admissions also were an issue of the wandering patients. Those who were wandering on the streets, their admission was a big issue because they should be COVID negative, and these issues we were facing. Next. Next. Next slide, please. Few initiatives what we had taken in Chhattisgarh was, when you see the whole state, we had just 50 odd psychiatrists and maximum were practicing in the private sector. we oddly left with only 3 to 4 psychiatrists in our district hospitals who could take care of these services. So we found the deficiency of psychiatrists to be very worse. So what we did is we tied up with NIMHANS and we trained our doctors, that is the medical officers, for more than 1 year, like a bridge course, which had an on-site training and off-site trainings. And same way we trained our counselors on mental health and addiction services. And approximately 34 medical officers and 69 counselors have been trained from Chhattisgarh. And these people are now acting as frontline work at the district hospital in COVID pandemic support also. So last year, by their support, we could take up an OPD of more than 60,000 patients. And now this year, our patient number has still increased. It's close to 80,000 patients only at district hospital. So we feel that, the lack of psychiatrists shouldn't be taken as an issue, but we should bridge and bring up such more human resources who can, like the MBBS, who can be trained in psychiatry, and they can be used for services at the district hospitals. Next. Next slide, please. Next slide.
Sumi, I think it's taking some time to show on your screen. We have the next slide.
Yeah, so I just continue with it. We have another training model which we started with our community health centers and primary care centers. You can see the result of the telementoring which I spoke of. We took a 1 year long training and the impact was very nice, and we are seeing that they are very effective and they are supporting in the COVID care services in mental health also. The next training which I was talking of is called as the CHAMP training. It has been taken for 6 weeks, wherein 2 days are on-site training and later on we train them online with the help of NIMHANS. We found that this training model for the community health center and primary health center medical officers was very effective. Up till now, we have trained 8 districts and more than 600 doctors have been trained, and they have seen an OPD of 15,000 patients. So these people are also supporting us in the COVID care support because in their general duties, they are working with the isolation centers, quarantine centers, these medical officers. And when they are trained in mental health, they are working with those patients who have stress, anxiety, and they're able to give that, psychological aid to them at right point in time. Next. Next slide, please. So you can see the telementoring model wherein we are, training our doctors in depression, anxiety, and substance abuse. And you can see how the doctors, are taking CVC with NIMHANS and helping the patients in the community. Next. In the same way, what we have done is, if you see that the patient number, what we have dealt with last year and this year, April, at the time of COVID pandemic also, it's close to 14,501. So such learning models wherein, empowering digitally driven interventions and adult learning models, if can be taken, these people can be an asset for, fighting the COVID pandemic. Next. Next, what we did is the doctors who had been trained in mental health for a year long, we trained them on how to take care of well-being of doctors also with support of NIMHANS. So we have trained our 34 doctors who can take care of their own well-being, also mental health well-being, and as well as the community mental health well-being at the time of COVID pandemic. This one initiative we have taken up. Next. One another thing what we did is we have trained our Mitanin, the community health workers who are in the community, and the 24th training module was of Mitanin, and we have trained 60,000 Mitanin on mental health and basic addiction and the psychological issues. And these community health workers are helping us in identifying the patients in quarantine centers also, isolation centers also, and by home to home visit, what they are obviously doing. They are a real asset. I think Vikram sir also had told that community interventions would be very important, and that's what we have also, worked on. While we have trained 60,000 Mitanin on mental health, I think they can be a reaping source for us to help us as frontline volunteers who can provide psychological first aid to the needy in the villages. We have further trained our counselors to handle the COVID calls. 69 counselors have been trained by the support of again NIMHANS, and these counselors are getting trained on addressing all the issues related to COVID, and they have been doing telephonic counseling, they have been doing on-site counseling of quarantine and isolation centers. Next slide, please.
Sumi, you'll have 1 more minute for your presentation.
Yeah. So what I feel is the community health workers, if they support us, I mean, this is the training model which we were talking about, 69 counselors who've been trained. And the other thing what I feel is the government's response should be to increase the budget flow to the mental health program, because the need is increasing, and tapping the digital technology can be a way out, which we are trying with our CHAMP model, and we are trying with the weekend training. So we can come up with more such digital models of treatment of patients, and improving the community interventions, like having support groups, volunteer support groups, peer support groups, student support groups, family support groups. So such groups can help us identify the patients. If they are trained on time, they can help us in easy identification of patients and helping them out at right time. So I'm done with my time, I think.
You can wind up.
Yeah. Next slide, please. Yeah. This is the counseling what our trained counselors have been given. I've just shown a photo of it. I've given a video also. So we've been able to cater more than 5,800 odd people in isolation and quarantine centers, but this number is quite less. I mean, we have to reach out to many. And state level helpline, the counselors have been trained in mental health. They also approximately have supported 6,000 odd people with mental health issues. Next slide, please. So this is what I was talking about, the government's response, that community care model, and access to technology, leveraging technology, and government funding should be improved. Next. So I think this is the right time to tap the health policy makers, because they are also prioritizing mental health now. They also understand that people have mental health issues and stress issues. So we can tap this opportunity to get more funding. If you see Chhattisgarh in 2015-16, our budget was 0.14%. Now we have increased our budget to 4% of the overall budget, but still we are lagging behind. So I think we need to improve our budget line also. And we need to have mental health action plan for all these sectors like health, police, social service people, schools, other professionals also, because COVID is affecting everybody on large scale. And building convergence model is one of the way to, I think, help community more. I think the last slide is the next slide. Yeah, so the last slide, which speaks on community support models and working with Mitanin, the ASHA workers, we feel that Mitanin works, though we have trained them, they work on all the health issues, but super training someone called as Mano Mitan, who's very focused on Mansik Swasth, and calling them a Sakha or Sakhi in a village can help us more. And placing mental health in the Gram Sabha as an agenda also is very important, because panchayats play a very important role. So placing mental health as an issue and discussing on it in the panchayat, the VHSNC, is also important. So I wrap up with all these small experiences which Chhattisgarh has had, but I think we have to go way ahead and miles ahead to really serve 25 lakh people. Thanks for giving me this opportunity. Thank you.
Thank you, Sumi. Thank you so much. So we have, that was the final presentation from our panelists. Now we will be taking some questions that have been sent to us by our participants. So Dr. But there is this question that we would really appreciate if we could respond to. There is a possibility of all of us getting addicted to technology, both mobile and social media, as a byproduct of lockdown. So how do we prevent or deal with it? You will need to unmute yourself. We cannot hear you.
Yeah. So that's a great question, and like a lot of things, the some of the seeds of this issue were there obviously long before COVID, and increasing dependence on technology has made us susceptible to addiction to technology because technology, the way it's designed is designed to reduce waiting time and to minimize frustration and to provide a stimulus, a reward, a sense of novelty. And all of those experiences are hard to find in real life outside the screen. And therefore, if we are not careful, then we can easily turn to devices to ease things like dissatisfaction, anxiety, stress. It's not at all uncommon for people to use either media, digital media, or the smartphone to distract themselves from what is happening within. But what's happened, and we know that that's not healthy, right? There's plenty of good evidence saying that the more time you spend on social media, the more amount of time you spend with your phone, the less happy you are. And in fact, I think, while the research is still preliminary, I think one of the reasons it does that, like I was saying earlier, is because of not just the content, but also the form, the process. Many years ago when television came, Marshall McLuhan, who was a media commentator, said that the medium is the message. And the point here is it's not what you're consuming on your screen, it is the way you're consuming it that's the problem. And frankly, I've seen that, with each successive year, we are becoming sort of less capable of handling frustration. We are so used to getting what we want on the phone as soon as you tap a button. So, when consider that young people, and many of us actually spend so much time on this device that it really shapes our expectations from reality. So couple of key things. COVID-19, because of social distancing and lockdown, has asked people to become more comfortable with themselves, with solitude to some extent, with their own inner space, with their own minds. And therefore, I would really urge I would urge you not to do what you're used to doing, which is to fill up time that you don't know how to use otherwise, or where there's some internal discomfort. Don't go to your phone. Rather, stay with that feeling and practice a strategy like mindfulness, meditation. And the idea is that the more comfortable I can be with myself without distracting my mind, in a way, the more resilient I am. So if you give in to this temptation and if you don't exercise some discipline, then like many other substances, we could see an issue where long after COVID has passed, you still end up being more dependent on the devices. Someone else might be more dependent on alcohol, etc. So the key thing is becoming more comfortable with your own internal experience, to have some discipline in life and to have a real schedule that you live by, so that you make sure that your time is well spent, and to be very aware. And now there's so many apps now which tell you how much time you're spending on the phone. And it's very important, I think, to have one of those apps so you're actually you bring it to conscious awareness. We don't realize just how accustomed we are to looking at the device. We don't even know how much time we're spending on that, and of course, particularly challenging for children now, because a lot of kids are doing their school online. They're using devices to, to be educated. And of course, one of my big concerns is that, are we going to have a younger generation who's just more comfortable with isolation and with devices rather than real world interactions? And the hope, of course, is that this will get better soon enough that they don't get accustomed to this. And of course, as human beings, we have a great need to connect. So I'm very hopeful that this will be a passing phase. And as parents, if you have children, do as much as you can to engage them, in ways that doesn't use a device. Yeah.
Thank you. Keeping our conversation around young people, there is academics have been put on hold. Educational institutions are all shut. We have many students among us listening to you right now. So could you or Professor Vikram talk to us about these students and give them some suggestions how they can better handle the stressful situation?
Hi, am I unmuted?
Yes, you are
Hello?
unmuted.
So, there isn't a single answer for such a diverse group of people. That's the first important thing to remember. But in a general sense, I think what Sham said is absolutely right. Do not actually lose contact with your friends and family members. There are ways in which you can maintain your interpersonal relationships, which are so important for young people, even though we may be being asked to do physically distancing. Physically distancing doesn't actually mean no contact. I think it's really important to ensure that you're not consumed by the fear that has, to be quite honest, has been a production entirely of the media and government policies. This is a virus that, of course, is dangerous for a few of us, but is completely harmless for the majority of us. And this very fact has been so badly communicated that it's led to a pandemic that is worse than the virus. That is the pandemic of fear that is sweeping the country. And you can see that affecting everyone in various different ways. The tragedy of people returning back to their homes and not being allowed to return to their homes. So the tragedies of healthcare workers being stigmatized is a direct production of the very badly handled communication strategies. For young people, be sure that you're not falling prey to fear itself, because there is nothing more to fear than fear itself. And I think you be pragmatic in the way you are actually adjusting to physical distancing. And I think always I found that caring for others and reaching out to others is perhaps the most important way to feel good about yourself. And I don't say this only in a kind of in an abstract way. Being involved with social activities, that right now there is an enormous need for people in our country for even just basic necessities. Becoming available or part of movements that are trying to reach out to those vulnerable groups could in itself be something very fulfilling and purposeful, bring some purpose back in your lives. And finally, I think obviously be aware of the signals in your own minds that might suggest that you might need a little bit more than that. Be always sensitive to your own mental health, acknowledge that your mental health can be affected at times like this. And while at the same time, as I said earlier, do not medicalize things, that doesn't necessarily mean you don't seek help and support when you feel that you have those sorts of experiences that are unnatural, unusual, affecting your daily life and making you feel very, very miserable for long periods. And I think you know where to go for that kind of help. You've already heard some very good examples from Sumi. I wanted to actually just congratulate what's happening in Chhattisgarh. I had no idea about this. It sounds like a state that has gone much further than any other state in India that I'm aware of. And that's a really tremendous kind of program you have achieved. And I would really encourage you to share this information, the impact that you're having. I really don't think most states in India have gone anywhere near the scale that you have described. And more importantly, not just scale, but the real integration of the ideas of care that spans from the community all the way to the clinic, which is a very good textbook kind of description, but in practice has always been a big challenge. So, I wanted to just express my admiration for what Chhattisgarh has been able to achieve.
Thank you, sir. Thank you.
Dr. Lakshmi, is there something that you want to add? Please go ahead. You need to unmute yourself.
Yeah, quickly, just to add one point, while I know that we are talking about those who can access digital media and then, getting habituated to that. And of course, I, completely understand and I respect what the panelists have said. Going back to the drawing board and talking about Naisbitt years ago when he said high tech leads to low touch. But we are also looking at the other side of the pandemic, where recently in Kerala, a girl who did not have access to technology, in class 9 or 10 actually committed suicide because she belonged to a very, very poor, unprivileged family. So I think while usage is, something that we're speaking about, I think again this is a question of balance, a question of how do you balance, the entire, justification of overuse or underuse, and bring about, again, as I'm going back to my pet theme, within the framework of social justice and equity, to be able to, enable or not enable the use of technology, enable for those who don't have, because classes, as you said rightly, are getting very, very critical. We run an academy of learning for master's courses and diploma courses, and yes, we are planning to start with the digital medium, but we are taking stock of who has what kind of technology, so that they are not left behind, and so that they are on par with all those who are learning. So I just wanted to bring this point that I think we need to have a balance of enabling, or if I can say discouraging, because it also does have, like Dr. Bhatt said and Patel has mentioned just now, several other ramifications. Thank you.
Thank you, Dr. Lakshmi. That actually answers one of the questions which we were going to take next, about bridging the mental health gap for those who are unable to access resources online. So, Dr. Lakshmi, there is a question for you. So, what you train mental health professionals, and what have been some of the challenges one faces as a mental health professional, especially during the lockdown? And how do they address them?
Yeah. So very quickly and very pertinently, we train students in master's courses of social work and mental health, applied psychology, clinical and counseling with Tata Institute of Social Sciences in Mumbai. We also run our own diploma in community mental health and diploma in working with vulnerable children. Having said that, yes, and we are starting our international diploma with Sri Lanka in community mental health, training for some of the government, associates of Sri Lanka. So to answer the question there are two ways of quickly answering this question. What we definitely do have multiple challenges. Looking at, as I said, the offering of the courses. Right now, we are working. In fact, soon after this, I have to go back on a TESOL training as to how do we deliver the best kind of services for our third semester and fourth semester students. So one is the rollout. The challenges of rollout. How do you also ensure attendance? How do you do, evaluation? Because again, certain courses like social work, psychology require, a lot more intensity in terms of, when you're on ground, your teaching is entirely different. So that we are also trying to deal with what do we do with our field-based practice, because they almost use almost more than 100 sites or research, because where they go and collect data. The third thing, of course, is to do with working in the labs. Being able to actually work in the labs with the certain kinds of tools and equipment and so on and so forth. And so these are some of the pertinent challenges. And so what for now this talk we've taken is really to look at some of the conceptual courses that can be delivered, online, based on availability of, as I said, technology. So look at the theoretical components and design, a lot more practical elements, experiential elements, keeping in mind the COVID situation because of social distancing. So we are disallowing students to go to the field and collect data. Can you do secondary research? Can you do desktop research? Would you be able to combine and write a good, informative paper? So we're finding, challenge and creativity is always there on the deck, and we have to find resources to be able to do that. Where our diploma candidates are concerned, most of them are our NALAM workers who are akin to ASHA workers. Now we train them periodically. So now we are starting a tele helpline, how to do a tele helpline certificate course for 10 days. And we're also trying to see if we can enable through funders. We are very heavily dependent on institutional funding, through funders to give them the basic technology of most of them may not have a decent phone, even to have a WhatsApp. to be able to make them technologically a little more through, so that we can reach out. Same with the diploma and working with vulnerable children, because these are already people like ASHA workers and our NALAM workers who are doing grassroots level work in NGOs, CBOs, SHGs, and in the community. And for them to work more, it's important, more intensely with children in communities where we do not have a reach. So what we do across this kind of a boxed medium will be very different, and we are taking a lot of precautions so as, not to miss the, the spirit in the delivery, if I can say so.
Okay. Thank you, Dr. Lakshmi. Many people are also losing their loved ones right now. I'm sure you are mental health professionals. There are people who are coming to meet you with these with questions in their mind about how to deal with the crisis of death and bereavement. So, this is supposed to happen. This will happen. This is inevitable in a situation like this pandemic. So, how do you better deal with this crisis on an individual level? So, Dr.
That's
Sham,
a tough one.
that's
Thank you.
a tough one.
Go ahead.
Anyone could.
Okay, I'll go ahead. So that's a great question, and a very, again, there are many shades to this. Firstly, it's interesting that arguably we are the only species that is aware of our own mortality, and that has to live and contend with that knowledge. Now, always think that if you were able to talk to your pet dog and you were to whisper in its ear that someday you will die, it will not be able to handle that information. Every other animal species responds to threat in the immediate present. Whereas we, because as I was saying earlier in my presentation, because of the unique nature of our brain, we are able to forecast and predict things. And therefore, we all have to contend with this knowledge that, we are not forever, and that people we love are not forever, and that transience is a fact of life, and death is always a fact of life, and that usually, even in the best situation, we can't actually predict when and how we will go. That is a fact of life. But it is a fact so scary and so difficult to comprehend that as human beings, we have all evolved certain psychological defenses against this knowledge. We might work for legacy, we might, work for another meaning, a purpose, something that transcends our own life to some extent, or as many of us do, we postpone thinking about the inevitability of this of mortality. But then along comes COVID-19, and even though we've always had risk, this is a new risk, and so suddenly the idea that we or people we love may not live forever, suddenly that feeling, that thought is now brought to the forefront, and we cannot escape that thought, and that is why there's a great deal of anxiety. It has awoken up a primal death anxiety that was always there, and arguably we always had to deal with. And so this is almost a spiritual question, which is, it's hard to answer this question. I mean, let me put it this way, that in truly trying to answer this question, you will have to answer very fundamental questions about what is the purpose of your life, how, what is all this about, and above all, a couple of other things. One is, make sure that your mind and your brain does not race into the future and create possibilities that that are unlikely. The problem here is, because there is threat, and because the brain is trying to get some predictability around the situation, all too often it does what we call catastrophic thinking. And so a person will then experience much more heightened risk than is actually there. Is there a real risk? Of course, there's a real risk. That's why everyone is, the entire world is going through this sort of crisis. But is it a huge risk for most people? No, it isn't. So now, what do you do with this idea that there's some risk, but it's not huge? Well, firstly, it has to, you take time to get used to this. And actually, I can tell you that I think the first, with time, I see a lot of people now getting used to the risk. Now, here we must be careful not to fall into these two polarities. One is of complete denial that there is any risk. That's again a defense mechanism. A lot of people say, hey, there's no problem at all. This is a hoax, this is a fabrication.
Yes.
There's absolutely no reason to panic. And the person who's saying that is secretly very scared and is using a defense mechanism to manage their terror. On the other hand, is a person who feels so terrorized, so fearful that they become paralyzed and are unable to act. So like with most things in life, we need that balance. We need to first say, look, what is the risk? It's small. It's probably, 0.01%, 0.1%, whatever you like. It's a small number. What can I do to minimize the risk? What is reasonable to do? In the backdrop of the fact that life has always been uncertain, what can me, myself, and my family do to take reasonable precautions? The third thing is, and to really engage that anxious energy into that action, taking precaution, but also making sure that you're actually improving your health. So rather than getting into this mode of survival where you're only thinking about how do I avert and fight and rather run away from the virus, why not think about how can I maximize my health right now, both my physical and my mental health? That has two benefits. One is that, of course, it improves your immunity, but secondly, it takes all that anxious energy and translates that into something positive, something actionable. So doing that and then really drawing a circle and saying what is under my control, what is outside my control. Stop putting effort on things that are outside your control, because that's futile and that leads to helplessness. So once you do that, you have that middle ground where you're taking precaution, but you're not getting overly panicked. And you then have to, and I think this is true not just for now, but forever and ever really, which is having done all that you can do, we have to find a way to surrender the outcome to whatever you believe in. And I think the point Vikram made earlier was very good, which is it helps to take your mind out of yourself. We do live in a time of great self-absorption, right? I mean, this is the era of self-absorption with selfies and social media and what have you. And we can get consumed by our own selves and our own worries and our own lives. And of course, there's so much suffering around us. If we can do something to mitigate that suffering, put that energy out, as I think many of our panelists have already talked about doing, I think that is incredibly powerful. I should also, one last thing, which I may say later, but I might talk about one last thing, which is in order to manage your mind's movements into the unpredictable future and bring out and sort of generate catastrophic thoughts, that's why I said earlier, it's so important for us to meditate and to be able to get some discipline around our attention. Where does our attention go? Can I bring it to the present as much as possible and to things that I can control? That will give me a lot of peace of mind. So that's another important skill when you're dealing with death anxiety or any kind of anxiety.
Okay. Thank you for your thoughts. We have many journalists who attend these webinars. There are many who are attending this one as well. So I would like to know all of your thoughts on what is the role that media can play in informing people about this pandemic, reporting during this pandemic, reporting about suicides while considering the privacy of affected people or groups. So what are your thoughts about it? How can they report more responsibly? What do they do to ensure that?
So maybe I'll go first here.
Sure, Dr. Vikram.
Just a very quick, I think before we think about suicide is how to report the pandemic itself. In a way that is factual, that is accurate, that conveys the truth in a way that is understandable to the community. I am so glad that finally, after 2 months, all the leading newspapers and television channels have stopped putting a ticker tape of how many people have died in the last 5 minutes in which part of India. The nonsense of these numbers, the fact that we cannot interpret these numbers in any meaningful way because of the vastly different meaning of those numbers from one part of India to the other or over time. And the way the media parrots it without any consideration. For example, today we were told that India has overtaken Italy, but India has 1/10 the population of Italy, not even understanding the basic facts on how you actually communicate risk is just shocking to me. That said, I think the media has changed. It has started presenting these facts in a much more sensitive way. I actually think the media has been doing a good job on mental health, you know, as compared to 20 years ago, when suicides were reported in a very, you know, I think hellish way. Today, I think there's a lot of sensitivity, a lot of description about the context in which suicides are occurring, connecting suicides, for example, with extreme poverty and so on. And what I would like to see the media do a lot more of is to become a vocal advocate for the improvement in the access to quality mental health care, to actually highlight the ways that this can be done in ways that are not only accessing the upper middle class in urban areas, but the hundreds and hundreds of millions of Indians who will never be able to get onto a webinar or a telemedicine session. And I think that is really what we need to get the media to talk about. And again, you know, like the Chhattisgarh model could be one of those examples that they might want to highlight.
Thank you. Dr. Lakshmi, is there something that you want to add?
Yeah,
Yes.
I'd like to just add to one or two points about the media. One is that the media must consider itself a very responsible stakeholder for any kind of health and mental health in the pandemic times. One. So while yes, all of that factual reporting, etc., I think they're beginning to do that for every so-called dismal story, which they inevitably perhaps have to share for their own reasons, which I don't want to go into. But there are positive stories as well. There are more positive stories and happier stories. So, and also I think they can play a great role in destigmatizing COVID to a large extent, destigmatizing what happens to healthcare workers, personal assistants, caregivers, doctors, drivers. We hear a little bit of spattering of this and that, but maybe a little more vocal about not just media, as in not only print media, but television media, digital media, Twitter handling. So I think, media, encapsulates the whole fourth estate, and we don't have, any rights really over what the media does, unless you have strong voices. But I think media, if I would like to say that from the point of view of mental health, because mental health sometimes is a very, has a dubious distinction of scaring people for somehow. Just to give you a point that somebody said, I'd rather have COVID than have mental health disorder, and that was pretty shocking for us to hear, in a sense, because it's still, it's in the dark dungeons of somebody who's mentally ill, perhaps has come to a full stop in their lives. So I think media portrayal, and that also means films, if I can say so. I know they're journalists, but people are all sitting at home and making films as well. To be able to see that there is responsible stakeholder and a partner in mental health, in mental health success or predictors of positive mental health. I think that's what I wanted to say, and to look at, yes, they're doing a fabulous job responding to what's happening to the poorest and the lowest resourced elderly, children, and all of that. But I really would think media can destigmatize in and through their reportage a lot of myths that are going around as well in this COVID-19 times. Thank you.
Sure. Thank you, Dr. Lakshmi. So we are still getting so many questions for all of you, and as I said, we will not be able to cover all of them. So I'll just take a quick word from all of you. So if it were just one thing that we should all keep in our mind to take care of our mental health during this pandemic, what would it be? So Dr. Sumi, if you would go first. So what is the one thing?
To do yoga and pranayama every day.
Dr. Lakshmi? That one thing.
That one thing. I mean, I don't want to be prescriptive here at all. Each one must, figure out what really mental and emotional, physical, and I think it's a whole social health is to connect with that you connect with the most, and for me, if I were to just give a personal example, I think it's a lot to do with how, I connect with my, our clients and speak to them, and on that level, to be extremely available. I don't know, I don't want to use these words like compassionate, but just to be there to see some of our clients, talk to them, talk to our children. And of course, for me, the personal takeoff is lots of music. Thank you.
Thank you. Dr. Vikram.
So for me, I think the advice is do something for someone else that gives them pleasure. I don't think there will be anything more pleasurable than to see someone else happy.
Thank you. Dr. Sham?
If I may, thinking about maybe two things, one sort of a little more profound, one a little prosaic. One is, I think, get some meaning around what is going on. Find out in what way this time can become meaningful, so that when you look back at this time in retrospect, you'll see this as a time of great learning and growth and connection and compassion. The second thing is probably self-evident, but really important: sleep adequately. Make sure you're not sleep deprived. A good night's sleep will help a lot of things.
Thank you. There are surely 5 of these things that I'm taking with me. So on behalf of our audience and partners, I extend a sincere appreciation for the work that you and your organizations are doing and contributing immensely in areas of health which are not even openly talked about, and we are in 2020. We hope that this webinar inspires ideas and discussions around mental health care during these times. So we have listed, Yukti, if you could go one slide back, we have listed a few resources so that our audiences can read them. And we will also, with your permission, be sharing the presentations after this webinar. And there are a few questions that could not be answered, but we will be sending them to our panelists and get back the answers to you very soon. I thank all our panelists again, all our listeners. A big thank you to my team. We look forward to your feedback on this webinar and on this entire series. Thank you all very much.
Thank you.
Thank you very much. Thank you, and bye-bye.
Thank you. Thank you.
Bye.
Thank you.